You ever see flashing lights and wonder what's really going on in those first few chaotic moments of an emergency? I mean, from the outside, it can look like total pandemonium. But underneath all that, there's this incredible, highly organized system working at lightning speed to save lives. So let's pull back the curtain and dive into this hidden world of hospital emergency response. To really get just how high the stakes are, we've got to start with one crucial concept. It's a question that's basically burned into the brain of every single first responder. What is the golden hour?
The golden hour isn't just some catchy phrase. It's a real proven idea that completely changed emergency medicine. It's that critical 60-minute window right after a major injury. And the data is crystal clear. If the medical team can get a patient stabilized within that first hour, their chances of survival and making a good recovery just skyrocket. That's why every single second counts. The entire system is built to win this race against the clock.
So, how in the world do they do it? Well, here's our game plan for this explainer. We're going to start with the big picture, the emergency ecosystem. Then we'll see how the alarm gets sounded. After that, we'll look at the most dangerous crises, check out the tools they use to fight back, and finally, see the amazing role medical imaging plays right in the middle of all the chaos. Okay, first up, the emergency ecosystem. And this is key, because when a major accident happens, the ambulance doesn't just go to the closest hospital. Nope, it's routed into this whole network of specialized centers, each one designed to handle a different level of crisis. So this is where it gets really smart. Look at the difference here. A level 1 center, that's the top dog. They've got surgeons and advanced imaging in the building ready to go 24/7. Now compare that to a level 3, which is more like a smaller community hospital where specialists might be on call. The whole point of this system is to match the patient to the right facility. It makes sure a smaller hospital doesn't get a case it can't handle, and it gets the patient to the exact level of care they need, as fast as humanly possible. All right, so we've got this incredible network of hospitals, but how does it all get fired up? How does the system snap to attention when a crisis hits? Well, it all comes down to a special language of urgency and a rock-solid system for setting priorities in a split second. I'm sure you've heard this one yelled on a medical drama, right? Stat. It actually comes from the Latin word statim, which literally means at once. And in a hospital, there's zero ambiguity about it. It means right now. A patient's life is on the line and any delay is unacceptable. That order goes straight to the front of the line, no questions asked. But what happens when it's not just one patient? What if there's a disaster, like a huge multi-car pileup? That's where triage comes in. It's this incredibly tough but absolutely necessary process where a senior person, usually a doctor, quickly assesses every single victim. They figure out who is most critical and who can wait, all to make sure that limited resources are focused where they can save the most lives. It is literally the definition of creating order out of chaos. And to make sure communication is instant and crystal clear, hospitals use these standardized codes. Think about it. Instead of someone running down the hall shouting, "There's a fire," and causing a panic, you just hear code red over the intercom. Code blue means someone's heart has stopped. Everyone on staff knows exactly what these mean and what their job is, allowing them to respond instantly without any confusion. So, the system is activated, the language is clear. Now, the focus shifts entirely to the patient and to those life or death conditions that need immediate help. This is where all that training really gets put to the test. When responders arrive, they are laser-focused on what we can call the big three. First, respiratory emergencies, because if you can't breathe, nothing else matters. Brain damage can start in just minutes. Next, cardiac emergencies, like a heart attack. And finally, shock, which is basically a catastrophic failure of the body's entire circulatory system. Let's just zero in on cardiac arrest for a minute. When a person's heart goes into what's called ventricular fibrillation, it's this chaotic, useless quivering that stops blood flow. The situation seems totally hopeless, but there's an incredible statistic that gives us a lot of hope. More than half of these victims can actually survive. But here's the catch, and it is a huge catch. That 50% plus survival rate, it's only possible if defibrillation, that electric shock to reset the heart, happens within this tiny, tiny window of just 3 to 5 minutes. After that, the chances of survival plummet. This is it. This is why speed is everything. So you can see how time is everything. This is especially true with shock. Now, when doctors say shock, they don't mean you're just surprised. It's a really dangerous medical condition where your body's delivery system, your circulation, is failing. Blood pressure drops and vital organs aren't getting the oxygen they need to survive. It can be caused by all sorts of things, but the response is always the same. Act fast.
And because shock can happen so fast, every single person in that hospital is trained to spot the early signs, things like a patient getting restless or having a really fast pulse. And their response is like clockwork, a drilled procedure. Stop what you're doing, get the patient flat on their back with their feet up to help blood flow to the brain, call for help immediately.
Now, to fight these crises, teams aren't just relying on their training. They have a whole toolkit of specialized gear, all of it strategically placed and perfectly maintained, just waiting to be deployed at a moment's notice.
And the discipline around this equipment is absolutely intense. This quote from training manuals basically says it all. You never borrow something from an emergency cart for a routine task. It is a sacred, unbreakable rule. Because that one missing item could literally be the difference between life and death.
So what's inside one of these legendary crash carts? Well, think of it like a mobile ICU on wheels. You've got everything from airway tubes to emergency drugs. But the undeniable star of the show is the defibrillator. It is the only thing that can shock a heart out of that deadly fibrillation we were just talking about. Everything else is there to support the patient until that machine can do its job.
Oxygen is obviously a cornerstone of emergency care, but it's not a one-size-fits-all deal. A simple nasal cannula is for someone who's pretty stable. But for a patient in serious trouble, they'll use a non-rebreathing mask, which can crank the oxygen supply up to almost 100%. The method is always tailored to what the patient needs in that exact moment.
And remember that 3 to 5 minute window we talked about? That's exactly why you see these AEDs in airports, gyms, and offices now. They are brilliantly designed so that almost anyone can use one. The steps are super simple. You turn it on, stick the pads on the person's chest, and just let the machine do the work. It analyzes the heart's rhythm and will tell you if a shock is needed and exactly when to push the button.
Okay, so let's bring this back to one key person on the trauma team who has a uniquely difficult job, the radiographer. Their mission is to get a perfect, crystal clear diagnostic image inside the absolute storm of an emergency, giving doctors the information they need to make those life-saving calls. Getting an X-ray on a trauma patient is a completely different world from a routine exam. Normally, you're the one moving for the machine, right? Turn this way, hold your breath. But in a trauma situation, the patient often can't move at all. The radiographer has to become a creative problem solver, maneuvering this bulky equipment around the patient, all while in a super high-pressure room, to get the perfect shot without causing any more harm. It takes incredible skill. And that really brings us back to what this is all about. When you look at these review questions for healthcare professionals, you realize something profound. For them, this isn't just about passing a test. Knowing the answer to what does code blue mean or what are the steps for shock, that's knowledge they have to access instantly, without a second thought, in the most stressful moments you can possibly imagine. So the next time you hear a siren and see an ambulance racing past, maybe you'll see it a little differently. Not just as a vehicle rushing toward chaos, but as the first critical link in this incredible, organized, and deeply human system that's about to spring into action to pull a life back from the brink.